everybody. I'm Dr. Christy Taylor, founder of Work Solutions LLC and Work Global News Magazine. And I am so excited today to bring another interview for our Changemaker series. Mrs. Sharon Herbert, she is a registered nurse known as the Power RN. She's a dedicated nursing professional with over 30 years of experience across clinical, administrative, educational, and leadership roles. Her passion for promoting nursing satisfaction and success really inspired her to establish Power in Nursing Innovations, which is a coaching and motivational platform. Sharon, we are so excited to have you today and to welcome you not only for this interview, but as one of our featured speakers for the Prescription for Career Success Summit. Let me turn it over to you and so that you can introduce yourself to the audience.
Well, thank you, Dr. Taylor. Yes, I'm a registered nurse and I have been one for more than 30 years. I've wanted to be a nurse since I was 5 years old. So that was a check mark. Got it. I have worked so many years as a neonatal nurse. And in that time, I loved what I did, but I also got a chance to see the toll and the stress that short staffing, long hours, and burnout was taking on my colleagues. And the more we worked, the tireder and more exhausted we got. But but the rules are you can't leave until you get relief. And so the tired, exhausted, dedicated, talented nurses were struggling to balance their love for what we do, the passion, and the stress of what comes over you when you're working 16 hours plus 8, sleep for 2, and come back and do it all over again. And that was something that, well, we do, we try, we just say we have to do it, we just keep trying. And the
Mhm.
second real moment for me was when I found myself in a place where all those hours and all of that work did not work for my body. And my own health crisis really forced me to step away from the bedside, from what I loved. And that experience made me realize that nurses need support, not just professionally, but personally as well. You need to eat and sleep.
Yeah, I'm so glad that you stepped into this because one thing that you and I have in common is like when people say the name of my business, they're like, Dr. Taylor, what is the name of your business? Because I spell it with an RX. People don't realize that
Yes.
I'm actually a health scientist by trade, with who's been working in education and healthcare for 20 plus years. And when I started as a career coach, my focus was helping healthcare professionals because of that very same thing, right? Because of burnout. When you work in an impact based career, when you're dealing with a heart centered type of career, you often deal with
Hmm.
burnout. But for us as healthcare professionals, it's really what I like to call passion fatigue because it's heart centered burnout, right? And you told us a little bit about that really defining moment that sparked your passion. So I want to transition the conversation in terms of, over the
Okay.
years, you've had an opportunity through your company to support nurses as they transition in their career. Now, you're one of our speakers who you have a general topic, but you also you happen to specialize in speaking to a niche audience as well. But during the Prescription for Career Success Summit, I mean, there will be people there from all different backgrounds. And so, what I just want to talk about specifically, though, for your niche audience, when you talk about how you supported nurses if they have transitioning their careers because of what you talked about, this burnout, it's not just the need to support them at work, but to support them in life, right? What advice would you give to those who feel
Yes.
overwhelmed and unsure about their first steps into the profession? But I guess I would caveat this by saying, Sharon, what advice do you give to anyone in any career
Yes.
who feel overwhelmed and unsure about their first steps?
Very well and very relevant for new grads and for just people. Just give
Mhm.
yourself a moment of grace. Don't always challenge yourself because you didn't get something done. You didn't do it the right way. Somebody else told you to do something and you said, oh, I'm just oh, I can't tell them I'm too tired. I can't say no. You can. Learn how to say no. There will be people who will continue to ask you, but you have to remember that you are important. You have to take care of yourself before you can take care of others.
I
And
love what
in
you said
that process, you get to learn.
about.
Even as you say no, you get to learn you can't do everything for everybody. You
I love
are
what you.
irreplaceable.
I love what.
Irreplaceable.
I love what you said about giving yourself grace.
Yes.
And right because you know I was looking at your bio and some of your work, and you mentioned, and just from hearing you speak previously, you mentioned personal experience with being overworked. Even you shared it kind of like as a part of your what kind of inspired you to launch your business. In your personal experience of being overworked, and you had a stroke that reshaped your priorities. How has that really influenced the way you coach nurses?
It is really a marker. I had to really get myself out of the closet, I will say, the place where you just don't believe anybody else's anything. Now, I am the one who can look in the mirror today and say, yeah, I almost died because I did not pay attention to my body and to saying no when you're tired, when you are on the edge, when you're sleepy, when you just don't feel good, just say no. But understand what your body is telling you because it is not a joke. It is not a joke to be the patient now because you weren't listening to your body. It's so important. It's another learning tool, but for me, I use that to really help folks understand what I'm speaking about is to help them avoid the pitfalls because you are irreplaceable. When you die, you're done. So let's not do that. Let's not die. Let's take care of ourselves and help each other stay afloat.
Absolutely right. I mean, one of the things that I think, even though you specialize in working with nurses, the advice that you're giving is really just for anybody, right? How many times do we sit there and when I've heard stories about people passing away, and they put up the job description within 2 days, right? Advertising for the next person because you can be replaced
Yes.
at a job, and so
Hmm.
you gotta think of yourself as right. It's like you dare doing a role, but you have to take care of yourself. And I think too. So when I talk about passion fatigue, you're in a perfect example of what I mean. Is burning yourself out, and it ended up okay having a stroke. But here we are, and I've been in that same disposition where I remember having a surgery that I was supposed to recover within a week, but kept trying to stretch myself to go back to work, and ended up having to take almost 3 months off. If I would have just sat down that week, I wouldn't have been in that
Hmm.
situation, right? And when you're working in these careers that um, where it's heart centered burnout, passion fatigue, is you really have to be mindful of the work that you're doing and the impact that it's having on you. Now, I want to talk specifically again about nurses, right? And we're talking about a lot of crossover topics here, but in your specialty, what do you see as the biggest challenge facing nurses as healthcare professionals? Really, I feel like this is all healthcare professionals that are in this space. But what do you see as the biggest challenge right
Yes.
now? How does Power in Nursing Innovations address those challenges?
Power in nursing addresses the challenges, really the emotional challenges that nurses face and every other person that works. They are feeling unworthy, stuck in their place, and they feel that they are not encouraged by the whoever the employer is or wherever the employer is. The more work we do, the more we have to do. You can be a teacher or you can be a cashier at the grocery store. It's the same. You feel unworthy, you're working hard, and you have a family. So you're
Mm-hmm.
stuck because you have to work, because you have to eat. and your family needs you. And that's really the crux of the irreplaceable. It's not as an employee, your family needs you. So
Yes.
that's why you stay. But you've got to be well. You can't take care of your family either if you're sick and in the ICU or in a worse place. Well, we won't even call it.
I mean,
So I won't
sometimes
say
it's
in the casket. You can't help your family.
absolutely. I mean, you can't work yourself to death literally,
Yeah,
right?
you
Trying to
can't.
do things for other people. And this is why so much I focus on when I talk about work that are external standing. I mean, I was focused
Hmm.
on healthcare, named the business Work Solutions, WORXK, because it was obvious that this was a healthcare business. And then in 2022,
Yes.
I changed my mantra to, us being a prescription for change and started doing more social impact work on a broader scale. But all of this links back to um, a passion for helping others. The work that you do is heart centered work as a coach. I want to kind of go off script here because one of the things that
Hmm.
you just kind of talked about was, people working and feeling unworthy in a work environment. And we focus a lot on workplace resiliency. I would
Yes.
love to, have you share your perspective in an article in the future about that, right? And your experience as a nurse. But let's touch on that for a minute. People,
Okay.
you went to school, you got your degree, you are at the table, you're in the work environment. Why are people feeling unworthy in their work environments? And how does that impact the organization?
Hmm. Well, it a lot of it can be similar, but it really depends on the specific organization that any person is in because they're all different. I will say this about nursing: many of us feel unworthy because when any decision is made at an executive level, nurses aren't generally included. And we know that most of us are women. We'll just leave that over there. But who believes, as they're looking at the CEOs and who's in the boardroom, that there's any real discussion about the worth of nurses? No, because they're looking at dollar signs. That's what they do. And nurses aren't really equated with dollar signs. They're equated with your picking up, cleaning up, moving things, which really doesn't mean a lot to the CEOs. It doesn't mean a lot to the public either. So here are nurses who are now saying, I worked hard, and nobody believes it because they have no idea what nurses do. But nurses don't often have any idea what they do. So they can't even stand for themselves in telling their patient who they are and what they do. So who's going to support a group of people who don't have any idea how to build relationships or communicate with the CEO or the patients about who they are and what they do, how important we are?
Yes.
Can we give an example? Can we tell a patient who we are and what we do? Not often. It's not on the curriculum either. I've been a faculty, so I know that it's not a part of the curriculum. So
So
it's
you
just
mean this in the
has
sense
been.
that is not that, because I want to be clear here. It's not, and I know this as a career coach, right? When nurses come to
Mhm,
me, because 80% of my clients are still nurses. When people come to me and it's
mhm,
like, well, I don't know exactly what I do. You've been doing bedside transactional type of engagement for so long, and yes, you do care. Yes, you are connecting with patients, right? But sometimes it can be hard to articulate your value when you've been doing all of this technical level type of work. And the work that we do is hands-on patient care, right? But it's a technical level
yes,
for healthcare, right? And it can be hard to translate that into, look, if if
to
if
what it
there's
is.
nobody doing this work, the patient doesn't get taken care of, things don't move and flow. So I have to help them to kind of really see and visualize, this is what you actually bring to the table. This is why you should be asking for more, and advocating more for the type of work environment that you like. Any
Right, and
comments
that's
on that?
part of. Part of the coaching program that
Hmm.
I offer is, who are you? We have to start with that. Why would you work and go through 4 years of school and work at a bedside and not be able to tell anyone who you are and what you do? How do you value yourself? You need to value yourself and demonstrate that.
You
Then we
know,
can move to next steps.
it actually plays into the next question that I have because, you talk about the biggest challenge. You've spoken on helping nurses to rediscover their purpose and passion, right? And kids, so
Yes.
I want you to just keep on talking about what you're talking about, but share an example of someone maybe that you worked with and it had an impact on their career because now they're able to be clearly articulate who they are and what they stand for.
Okay. There are several. I will choose one. A young lady that I worked with. She had been in nursing for 4 or 5 years, and she worked on a med surge floor. She really wanted to get a promotion and to be a leader. And she wanted to be the CEO. She leader on her unit, but she was never able to convince her managers that she was ready to grow.
Mm-hmm.
And in 5 years, she wanted to be the charge nurse. That's not rocket science, but they never would give her a chance. And so she came to me and asked, well, what could she do? And we made a plan. Let's look at who you are. Who do you think you are? And let's work with that framework and create strategies to help you build a platform that elevates you in your practice and even in the way you speak about nursing and or healthcare. You have to also be able to master communication. You
Mm-hmm.
can't say too many I don't knows. You will always find the answer. You don't have to know everything. I remember my first preceptor, I never forget her. I love her to death. She said, Sharon, you don't have to know everything, but you do have to know where to find the answer.
And I think that
You'll
that's
never say, I don't know.
that's the difference between shifting from management to leadership. Because right,
Mhm.
because as a leader, right, I don't feel like I have to do every single thing. I know how to delegate and manage my team, but also it's just a matter of being a resource. Why do people come to me as a coach? I think career coaching is so different than any other type of coaching than life coaching or advice because as a career coach, you are mentor, coach, advisor, right? You can
Mhm.
play any. You also are consultant. You can come play any of those roles at
Yes.
any given time. And I don't know everything, but what I do know is I'm gonna get you. I can find a resource that's gonna help you, right? Even if
Of
I have to
course.
pay,
Yes.
I'll get back to
And
you later.
true.
And I think that that's really a good point that you've made there in terms of like when people are you if you're looking for the next step, if you're looking and you don't understand what the gap that's happening, you need to do a self assessment there.
Do
Are
self
you
assessment.
showing
Mhm.
up and solving problems? And sometimes, and I say this all the time, when I talk about career branding, you have to be a resource to people. It's not just about you networking or shaking hands, right? You people have to see you as someone who solves a problem, right? It's no different from us running a
Yes.
business. Now, as someone who's led through transformational leadership, this is your style. Um, how do you inspire and motivate others to embrace change and thrive in their roles? We talk about getting to the next level, right? How do you
Okay.
inspire?
Well, I use storytelling as a good part of the example for transformation. I've been
Mm-hmm.
several places leveled from, ground zero on up. You have to know yourself. And that's a real sticky place for people. If you don't know yourself, how are you going to decide what you need for this recipe to create the steps for growth. You have to
Mm-hmm.
really know yourself. And like the young lady I was talking about, we created a platform for her where she took some courses, just short courses, even starting on communication, who you are. Are you afraid to talk to people? Do you know who you are? And there's a time and place for everything. Creating a resume. Okay, people say, well, what? A resume? What are you talking about? You better know how to do that because there's some good to that. And then there's some long, unnecessary
Stuff.
stuff that you don't need to put on there. You've got to know what's important about you and be able to frame that into your document, and you'll use that over and over. And she did that. She took a class in mastering communication. And how do you look for a new job? That's something we don't talk about in school either. School is about getting you out of there and getting the next people in. How do you prepare for the next steps? And the next steps. So we talked about choosing a position and then looking in your wherever your demographic is, wherever you're located, what's there if you want to stay there. And if you don't, you should know how to look for a job. Okay, we're just talking, just looking. I will just say you can Google it or whatever, but then you have to dig deeper
Mm-hmm.
into the organization. Don't just look on the banner that's hanging in the in the front
Right.
of the hospital. You need to look at what their strategies have been and how that's worked for them, how the nursing staffing has worked. What does the Medicare say about the outcomes for their patients? What does the news say about staffing? All those things she got a chance to do, and she chose to work in a dialysis clinic. And she came to me and she said, well, okay, I have three of them. Well, what should I do? Let's look at what the reports are. Becker's review has a lot of good information, but you have to use it. It's not going to come to you. And so
You're
she
absolutely.
did, and she got a position in the dialysis clinic as a manager.
That is
And
so
she was
awesome.
very, very happy, very happy. She has not looked back since that time
It's great to
and
have
still
supported
growing.
coaches like you. I'm going to ask the last question, and then I'm just going to get a
Mhm.
piece from you on legacy. So I think I can do this twofold. All of this
Okay.
stuff that we've talked about in this interview today, I just want you to briefly touch on what, just very briefly, give them like a 30-second tidbit on what you're going to talk about for the Prescription for Career Success Summit. What is your topic, and how are we going to cross over? Then I'm going to ask you one last question to wrap up.
Okay. My topic for the summit is really inspiring and motivating nurses because we're people. We're people too. We're not just you know, a dummy or what. We're people. And those people need to know what options or opportunities are available for them, not even just in the nursing profession. They can be anything they want. Be empowered, know who you are and what you want. Maybe you came to nursing because somebody told you and you really hate it. Love yourself and be yourself.
I was going to ask for one piece
Nope.
of advice, but I feel like that's the advice right there. We can get a clip of that right there. And so I'm just going to ask you one final question, and where can people find you in 90 seconds or less? Okay. So your legacy, and I love the work that you're doing and your commitment to helping other nurses, to empowering nurses. It's about empowering nurses, fostering a sense of community, and fostering career satisfaction. You are really committed to that through your organization. in your, from your perspective, what do you want the legacy of your organization to be, and where can people find you if they want to connect with you?
Okay. My legacy is promoting nursing and helping each nurse be themselves in the place that they want. They have to explore themselves and be fine with who they are and where they are. And if not, let's create a stepping stone strategies to growth, professional growth, and overcoming stressors so that you can move.
Sharon, where can people find you? Where
You can
if I want
find
to,
you
if
can
I wanted to
find
find you
me.
online, where would I
You
go?
can find me on Facebook at Power in Nursing Innovations, as well as LinkedIn, Power in Nursing Innovations, and on Instagram, which is a little fun. You can find the Power RN,
Listen,
and
we're going
we
to make
can
sure that
help you there.
we post your information in the description. It's going to be such an exciting presentation, and looking forward to really continue to work with you as we lead up to the Prescription for Career Success Summit. Sure, thank you for today, and we are so excited to continue our collaboration in the road ahead. And thanks for tuning in, guys.
And thank